dying in sleep. It's often described as the most peaceful way to go, drifting off and never waking up. In many cases, as people age, the body gradually weakens. During sleep, heart rate and breathing slow, and if an underlying condition like heart failure or organ decline is present, the body simply stops while consciousness is already off. There's usually no panic, no awareness, just a quiet fading as vital functions cease. Families often find loved ones in the morning lying calmly, as if still asleep. Medically, it's one of the least physically painful deaths because it happens while the brain is in a low awareness state, with minimal distress signals. It's not always how death happens naturally, but when it does, it's often gentle, quiet, and free from major pain responses. Sudden cardiac arrest. Cardiac arrest happens when the heart suddenly stops beating effectively, often due to an arrhythmia. One moment, a person can be awake and talking. The next, their heart rhythm collapses. Within seconds, blood flow to the brain cuts off, leading to rapid loss of consciousness, usually in less than 15 seconds. Contrary to dramatic TV scenes, many victims don't feel prolonged pain. Some experience a brief chest discomfort, but often it's more like a sudden blackout rather than drawn-out suffering. The body simply shuts down before the brain fully registers distress. That's why, medically speaking, sudden cardiac arrest is considered one of the least painful ways to die. Major stroke. While minor strokes can be painful or disabling, a massive stroke, particularly a large hemorrhagic one, often causes rapid unconsciousness. When a major blood vessel in the brain ruptures, pressure builds extremely fast. Many people collapse almost instantly and lose awareness within seconds to minutes. The brain, unlike other organs, doesn't have pain receptors in its tissue, so the actual damage doesn't produce direct pain. Some may have a sudden severe headache, but many simply become unresponsive quickly. Medical professionals often describe this type of event as fast and less physically painful compared to prolonged illnesses. Carbon monoxide poisoning. Carbon monoxide is often called the silent killer for a reason. It's colorless, odorless, and initially gives very few warning signs. When inhaled, it binds to hemoglobin in the blood more effectively than oxygen, silently starving organs of oxygen. Early symptoms feel more like mild flu, headache, dizziness, sleepiness, but as exposure continues, people often drift into unconsciousness without realizing the danger. Unlike suffocation, there isn't that violent panic reflex because carbon monoxide interferes with the brain's oxygen sensors. As levels rise, people fall asleep, become confused, and eventually stop breathing. It's medically considered one of the least physically painful ways to die because the body doesn't experience the intense air hunger of oxygen deprivation. Overdose of anesthetics. In controlled medical settings, like end-of-life palliative care, sedatives or anesthetics are sometimes used to ease suffering in terminal illness. When administered properly, these drugs lower consciousness first, causing patients to drift into deep sedation. As breathing slows and the body relaxes, vital functions eventually stop. Because awareness fades before breathing fully ceases, the physical pain response is minimal. Historically, this is how surgical anesthesia works too. Patients are unconscious before any painful procedure begins. Outside of medical supervision, overdoses can be unpredictable and dangerous, but under controlled circumstances, it's considered a calm, low-pain passing. Ruptured aneurysm. Aneurysms are silent bulges in blood vessels that can burst suddenly. When a major aortic aneurysm ruptures, it can lead to near-instantaneous collapse due to internal bleeding. While some people feel a sudden sharp pain, many lose consciousness within seconds because blood pressure drops so fast the brain can't stay awake. Cerebral aneurysm ruptures can cause a thunderclap, headache, but often unconsciousness follows quickly as pressure builds. The rapid shutdown of circulation and awareness means the window for pain is brief, making these events medically categorized among faster, less prolonged ways of dying, even though they happen unexpectedly. Medically assisted end of life. In countries where it's legal, medically assisted dying typically involves a carefully controlled sequence. First, strong sedatives bring deep unconsciousness, then medications stop breathing and heart function. The process is designed to eliminate pain and distress entirely, focusing on comfort. Patients are typically asleep before the body shuts down, meaning there's no physical suffering during the actual passing. While it's emotionally complex, from a physiological perspective, it's one of the most peaceful and painless methods because it bypasses the body's panic responses entirely. Severe hypothermia. In the early stages of hypothermia, the body tries to fight back with shivering and discomfort. But as the core temperature drops further, the body starts to shut down. Surprisingly, many people in late-stage hypothermia report feeling warm and sleepy, a phenomenon called paradoxical undressing. As the brain becomes confused, pain perception dulls dramatically. Eventually, consciousness fades, often in a state of drowsiness rather than panic. Medically, the body's nerve responses slow down so much that the end comes quietly. While the early stages can be uncomfortable, the final stage is often described as one of calm detachment, making it one of the less physically painful ways people commonly die in extreme cold.